It is appropriate for every normal, rational human being to want to improve on himself or herself. But in trying to do so, you have to know where you are starting from. You have to know the assets that you have, the gifts, the talents, the abilities that you have that you can appreciate, so that when you are improving on yourself, you can tell where you are starting from. So you are starting from step 1 to 2 to 3. So you must know what you already have, who you already are, that you want to improve on. For instance, for the human being to be created in the image of God, it means that the human being has the most elevated or the highest image a human being could ever have. Because God should not improve on himself. If God could improve on himself, we should ask the question, what would that higher version of God looks like? So if we have God's image and we want to improve on God's image in man, what would that higher version of God's image look like? So the image of God in man is not something that we are trying to improve. In addition, if you're a Christian, what it means is that your sinful nature that you inherited from Adam, that all human beings inherited from Adam, even babies, that sinful nature has been replaced by Christ's righteousness. So you have a free gift of righteousness from God. And so when God sees you, he sees you as righteous as Christ is. And you cannot ask God to improve on his righteousness, to become more perfect. So if God's righteousness is in someone, you cannot say you want to improve on this Christ's righteousness in the person. It is absolute, it is perfect. You cannot improve on it by something that you have to do. And you cannot reduce the Christ's righteousness by something that you have not done or something that you have done. Another thing that you cannot improve on is God's love towards humanity. It is unconditional. For God so loved the world that he gave his only begotten Son. At the time God so loved the world, there were no Christians, there were no believers. We only had sinners, because he was now giving Christ to the world to die for the sins of man. So we can have a believer or a Christian. So God's love was demonstrated towards unbelievers, towards sinners. So it's not now that you have become a Christian that now you want to impress God, to improve God's unconditional love. You don't try to improve that. Okay? So at a minimum, you should know what you are indoctrinating yourself with for the purposes of improving on yourself. Because there's an ethical principle that suggests that we can do good. It is called beneficence. But we should be mindful of causing harm to ourselves. And we call that non-maleficence, avoiding harm. So if you come to the medical field, for instance, if you have a sick person, you can improve on the health of the sick person from negative to positive. But I must indicate that it may be easier to improve on the health of a sick person than on the health of a healthy person. A healthy client is like somebody coming for medical checkup or preventive services. For a sick person, the person has symptoms, the person is in some kind of discomfort. So we can look at outcomes, some subjective outcomes. The person can tell you that the pain has subsided, the cough has ceased. All right, that's subjective. And objectively, we can measure blood pressure coming down, the sugar is reducing. We can measure with the thermometer, temperature is coming down. Objectively, you are seeing improvement in the interventions. But when it comes to a healthy person coming for medical checkup, for instance, you are mindful that you don't want to cause more harm to this person. Somebody can be anxious because of the expectation of a medical diagnosis from screening. The person is just coming for medical checkup. So don't do things that the person does not need. We have what we call false positive results. You are checking somebody's blood pressure, the BP apparatus is giving you problems. The blood pressure is abnormally high, and then you started medications. Or maybe the person just came in anxious, and sometimes we have something we call white coat hypertension. You don't verify by monitoring. Then you start the person on medication. The medication sometimes might have some side effects, and the person is having side effects from the medication. It is somebody who did not need medications in the first place, but is having side effects from medications. You are trying to improve on the health of a healthy person, but you are ending up causing harm to the person. Of course, medical practitioners. We are meticulous. So we try to do things right. But I am trying to prove a point that if you are a person and you're trying to improve on yourself, you should know where we are starting from. You are created in the God's image. If you're a Christian, you have Christ's righteousness. You are unconditionally loved by God. So if you are indoctrinating yourself or receiving indoctrination, at a minimum, it should not touch your God image, your sense of dignity based on your God image, because that you cannot improve or you cannot reduce. It's the same. Christ's righteousness, you cannot change that. You cannot do anything about that. God's unconditional love, you cannot do anything about that. So the goal is that you are not supposed to cause any harm through indoctrination, education, brainwashing, just because you want to improve on the person. We have to know what the person already has. And when we appreciate, borders on the person's sense of well-being and dignity. And if there's anything else we want to do, it should be to rather improve on the person's mental, emotional, and physical well-being, and avoid situations whereby you want to create problems for people by telling them things that they are not, making them feel inadequate, feel less than, feel guilty, feel condemned, feel anxious, worried, afraid, so we can offer solutions to them and so we can become the heroes who are solving their problems. Perhaps if they were reminded of who they are in terms of being in a God image, in terms of Christ's righteousness, in terms of God's unconditional love, you may not have too much work to do in trying to improve their mental well-being, their emotional well-being, or their physical well-being. It is difficult to improve on the health of the healthy, but generally, the caution is that first do no